And so today I want to talk about assessing and treating hip internal rotation. And before I do this, I want to talk about why it's so important. So hip internal rotation is a foundational movement at the hip joint that is needed for walking. So for instance, if I'm taking a step, my pelvis turns to the left, which causes internal rotation. Or if I'm a golfer, I'm going to get after the golf ball and swing, I need a lot of hip internal rotation here. If I'm a football player trying to cut, I need a lot of hip internal rotation to load my hip. So it's really important for your athletes and your clients and patients. And usually what you'll find is knee pain, foot pain, or lower back pain when it's oftentimes neglected or limited. All right, so we'll go ahead and start with your foot right on the X there, and then you're just gonna go ahead and walk around to the side there. And as you can see, Wooly gets kind of jammed up there, and you can also just kind of get a little of the end feel there. He's going to lose his balance. That's about all he has. So he got about to the purple line there, and then he's going to go ahead and switch sides. You can already see he already surpassed that motion. So now we're going to do a couple of mobilizations to work on that mobility, and we'll see if it gets better. All right, so now that we took a look at his hip functionally, we're going to look at it statically. And it was his left hip that was limited, so I'm basically just going to come in here, I'm going to do some passive range of motion, and as you can see, he's pretty limited. Usually patients will compensate with the hip internal rotation. You'll think that you'll crank away and you'll think they have all this rotation, but they really don't. As you can see, his pelvis starts to move kind of early on, so that's literally probably all he has on that left side. And if we come over to the right side, we can take a look at it. And I bring him in here, and he's got maybe 10, 15 degrees more. So we're gonna go ahead and treat it really quick, and then we'll reassess. All right, so now that we found the deficits in that hip, we're gonna treat it here with a mobilization with movement. And so I got Wooly here laying down supine, and I got a belt around my hips here, and I just wanna kind of bring it low as I can comfortably. So this is a technique Brian Mulligan is really famous for, and it works really great for loosening up the hip. So basically I just hold onto his femur here, I stabilize his pelvis with my right hand, and I kind of sit back into that distraction position of that hip joint. And then I'm going to ask my patient, Wooly here, to rotate his hip internally while I kind of keep that glide, and then come back in and out of it. I'm just sitting back, and it's quite comfortable for most patients. Sometimes you might have to add a pad by the groin for the belt. It's already loosening up, as you can probably see off video land. He's getting a little bit further each time.
That should feel good.
And good. Okay, so then now we'll retest, and then we'll just kind of rotate, and you can see he got quite a bit more motion already, but now we're going to take it one step further and look at the test functionally. Alright, so we're going to go ahead and retest Wooly's left hip internal rotation. If you remember from the previous video, he was pretty limited. So Wooly, go ahead and do that retest. So as you can see, he can go, 3 or 4 inches, probably a little bit further.